was just telling everybody how you and I met when you came to CHOP, and that's how we became really good friends. But you
Hmm.
introduce yourself and tell everyone where you're from, and then kind of go from there.
I'm Mckenzie. I'm 28. I've got three kids. Jason, he's about to be 5. Elena's about to be 4. And then Olivia is my BWS baby, and she's currently 13 months old. And I'm from Indiana.
Woohoo! um,
Oh my goodness.
so I guess just tell everyone. I know your story, obviously, but tell everybody
Right.
kind of where your story started. I don't know. You didn't know ahead of time with her, right?
I didn't know ahead of time, but about the start of the second trimester, I kind of knew something wasn't right.
Mm-hmm.
Her all of her movement came early. She was always measuring ahead of time in terms of my stomach, and it just felt a lot different than the first two pregnancies. And then I had some complications, so I had to actually have quite a few ultrasounds. And besides the first ultrasound, which seemed normal, gave me what, July 14th due date. Um, After the first one, it started with the second one, but her bones would start to measure even older than her just gestational age.
Hmm.
So each one, the ultrasound techs didn't understand what was going on. They didn't understand why the due date was that far when she was measuring weeks ahead of time.
Right.
And I brought it up to my OB. She kind of always dismissed it because research shows that the first ultrasound is the most accurate in terms of date.
Mm.
So they just kind of dismissed it. Well, again, the discrepancy kept getting larger through pregnancy. And then I was in a lot of pain towards the end.
Hmm.
And I was kind of just like, okay, we're going into labor today. I'm done. Can't do it. I know she needs to come out. She doesn't have enough room. I just know.
Yeah.
So I went into labor 3 weeks exactly early.
Wow.
And about halfway through labor, though, I stopped. Like my body was just like, no, I'm not really ready, even though
Oh.
she was. So they kind of had to restart it going. When she was born, she was very purple. Like I saw a post in group recently that was talking about, slightly purple babies and how it's normal. And I saw a bunch of pictures and I'm like, oh my gosh, like Olivia was way darker than this. She was bruised and swollen from head to toe,
Wow.
which immediately threw her into jaundice. She had to have like the Billy blanket and the lights and everything.
Oh.
And then when she was born, they were all amazed at how big the placenta and the cord were. Like they were
Yeah.
freaking out. They didn't know if they had a clip big enough to kind of like clamp her cord.
Yeah.
Um, and then immediately she wouldn't nurse. So her blood sugars dropped. They kind of didn't think anything about that. And then that first day, I had finally fallen asleep. They took her because she wasn't nursing and her sugars were low. They were kind of cup feeding her. They would
Mm-hmm.
like tilt her head all the way back and they would just kind of pour it into her mouth and like let her swallow it that way.
Right.
Well, they took her right before I fell asleep. And then I guess I woke up like 2.5 hours later and Andrew's freaking out, like, what is she doing? She's usually back by now. What's going on? So I called the nurse in there and she comes in to tell me, she's like, we were just about to come inform you. She's like, we almost lost her. They were cup feeding her and she started to choke. She aspirated her oxygen tanks. Like they almost
Oh
lost
my.
her.
Oh my God.
And after that was when they finally noticed her tongue was too big. Like in all the pictures I've got of her, you don't see the tongue at all. It's like in her mouth, her lips are closed. She looks perfectly normal once the bruising, the swelling kind of went back to normalish.
Yeah.
Um, but then so she tells me this, and like we're freaking out.
Yeah.
And they have her set up in a different room and they bring her to us, and I just lost it. They had her like hooked up to IVs, they were giving her sugar water, um, and all of a sudden her like tongue's hanging out.
Yeah.
It was the first I'd noticed it. So nobody knew what was going on. They were just really concerned. Um, I got lucky. There was 4 pediatricians I could have come in and assess her. The one I chose had actually read an article about Beckwith. So like after she
Wow.
came in and did her assessment, after all this had started happening, She came to me. She's like, well, there are several syndromes that I think it could be. I've got it narrowed down. She's like, I want to call around. I'm going to get you transferred. She needs to go to NICU. So she did that, and based on what she thought it was, she contacted Dr. Escobar in Indy. It's like the state's best geneticist here. Um, so she had us sent there, and I was able to discharge a day early to go with her.
Okay.
So she ended up in a NICU 2 hours away from us, and
Oh,
I don't know, it was kind of surreal. Both babies before I took him straight home, like people got to meet him, got to visit, and we went straight to the hospital. I stopped going to class. Andrew
yeah.
stopped going to work. Our kids are staying with other relatives. We can't see the kids. We're constantly in the hospital over there. And they don't know what's going on. They did bring up BWS, and they're like, well, it's kind of the working theory here. We need to have blood drawn. You still won't have an answer for like, 2 months. And so during the meantime, they noticed that she also had an umbilical hernia. She had a hole in her heart. Both of her kidneys were enlarged. Of course, her oxygen was tanking.
Yeah.
So they could not lay her back on her back. She had to be side laying or like on her stomach the entire time. And then they ended up wanting to do a sleep study just to kind of see what was going on with it. They read a little bit about Beckwith after that's what they thought she had. Um, so they knew that apnea could be a problem. Well, she ended up getting her first one done the beginning of July. I remember it was supposed to be done July 3rd, but like everybody took vacation for the fireworks, so they like made her wait another
Oh,
3-4 days. We were like heartbroken. It's like, dude, we just want to go home. Like we haven't seen
yeah.
our kids.
Oh,
So they did the sleep study and noticed that she had obstructive sleep apnea. They were refusing to discharge her. They brought in a plastic surgeon after an ENT had looked at her. The ENT made the comment that her jaw was recessed, that, that was what the problem was. So they brought in a plastic surgeon. And admittedly, none of these people really had heard of Beckwith or knew anything about it.
right.
So the plastic surgeon came, sat us down, and he told us their plan for her. They wanted to basically do a jaw distraction, but I don't think this certain surgeon knew enough. He wanted to put the brackets on her jaw, and for 14 days, every day he would break her jaw and push it out further, a millimeter further every single day.
Oh,
Um,
on a
and actually, he
newborn?
wanted to bring it. Yeah, yeah, she was probably like, she was only in the NICU for a month. So they were talking about this at like week
Oh my
3.
gosh.
Yeah. And they wanted to do it immediately. And I
Jeez.
didn't know anything about the syndrome at the time. I didn't know
Yeah.
anything about the procedure, but that was, oh my gosh, that was terrible to hear that. But he had made the comment that he didn't want, her jaw was already in perfect alignment.
Right.
He wanted to bring it out like a lot further from her face, like really deform her.
To just fit the
And I
target.
remember yeah, he was thinking if they brought it that far forward, it would have enough room to just lay there
Oh my
and that she would
God.
grow into it. And his comment with it was, because we were like stunned, like, you're going to bring it that much further? And he's like, he's like, we're not worried about her looks. He's like, when she's 16, we'll bring her back in and like put it back in the correct position. So they're going to do
What?
the surgery twice, really. They're
Oh,
going to
okay.
deform her and then break it back eventually and put it back into proper alignment. Um,
Oh my
and
God.
his infection rate was like 25%.
Oh gosh.
Statistically, she was next to get infected. Just his plan for it didn't give us confidence. It scared us. We were worried. She's 3 weeks old. So we ended up, Andrew found this group. Andrew found the BWS group, and we started looking on there. And he kept seeing somebody mention Deanne Wilson in the Mercy Hospital in St. Louis. So I reached out to her, and it was her day off that day, and she spent like literally all day kind of giving me a crash course over the phone on BWS and these
Oh,
procedures. And she kind of strongly advised against the jaw distraction, for a
mhm.
couple of different reasons. she was basically saying that sometimes, the distraction is necessary, but it's usually more of like a last resort, kind of along with the trach. You don't want to have to do those unless you really need to.
Right.
Um, and then she was telling me about the age restrictions and everything, that if they were to do it for us, she had to be 6 months old. Um, so then she suggested, okay, they won't release her from NICU. She's like, go ask for a repeat sleep study with oxygen, see if that changes anything. So we did. And they gave us that request. They did another sleep study with the oxygen, and it had looked like her apnea got a little bit better.
Mm-hmm.
Better enough that Dr. Conley, her pulmonologist, came picture and was like, I want to give this little girl a chance to grow, chance to get stronger, see if she gets better. If she doesn't get better, at least she's a little bit strong enough to, kind of undergo surgical intervention. So she got everybody to discharge her around a month old. And then her condition was, in another month after that, she would stay on the oxygen the whole time. And then at 2 months old, she'd have another sleep study. So we thought she'd gotten better over that whole month. She was on a monitor. It didn't seem to red light at all. She seemed fine. She seemed like she was getting stronger. So we thought, the best was, about to come.
Mm-hmm.
Um, and then her second sleep study at 2 months old, she'd gotten like dramatically worse.
Oh.
Her AHI was 33.
Oh.
Um, yeah, and then her biggest concern is at 2 months old, an infant is supposed to be getting 50% REM sleep. Olivia was getting 2.8%.
Oh.
She's like, look, her brain is in self-preservation mode. It
Yeah.
knows that if she goes to deep sleep and kind of tries to recharge her body, restore everything, that she won't wake up.
Yeah.
Um, and that made a lot of sense because Livy like never slept. She was constantly awake. She would always want to sleep in my arms, and
Yeah.
like the second I moved her, she was awake. She always seemed tired, and when she was having like her tired bouts, she would seem angry, she would seem frustrated, but other than that, she was happy. So it made a lot of sense. But then after that, she was like, look, call whoever you need to call. She needs intervention immediately.
Yeah.
So I ended up calling Dr. Kalish at CHOP, and I told her the scores, kind of updated her. I talked to her briefly before, but it didn't seem like we needed her. So I called her back, told her everything, and she's like, let me call you tomorrow. It sounds like she needs surgery sooner rather than later. So she called back the next day and had an appointment scheduled for her 3 weeks later at
Oh.
CHOP to have surgery.
Oh.
So that was like, yeah,
Yeah.
that was kind of, I don't know, that was heavy news. Like, in a way, it was a relief. Like, we're going to do something that seems safer, that seems more effective. Because in that time, after talking to Deanne the first time, I really started educating myself.
Yeah.
I went from being like meek and mild to kind of just taking whatever the doctors had to say,
Right.
wholeheartedly. I kind of started standing up for ourselves and her care and getting what she needed done. Um, so I'd gotten really educated, and we knew that was the best place for her if somebody could prove that she needed surgery. Then it kind of became of how do we manage this? We've
Yeah.
got three kids, me and him. He works full time. He works like 14 hours a day. He can't really take that long off of work. We've gone through our savings with the NICU, and taking two children, I'd have to leave school. We ended up deciding that I'd leave them behind, Andrew and Jason and Elena, that I would leave. And I went to school on a Wednesday. And then that night I drove to Philly 12 hours through the night and had back to back to back to back appointments the next day.
Yeah.
Um, and it freaked me out. It's like that's the longest I've ever been away from my family. I was missing school. But I met you
You did.
and you made it. Yeah, you helped a lot. Um,
Good.
but then, meeting Dr. Kalish and Dr. Taylor, I mean, it put me at ease. It really helped me kind of, calm myself down. She needs this. It'll work out. Um, I lived in somebody's basement for a few days until she got admitted for surgery, and then I lived in the hospital room the entire time.
Yeah.
Um, Yeah, and then they were supposed to have her off of the ventilator 5 days in, which is usually like the timetable they like. Um, but then, of course, with her, her swelling didn't start happening until the fifth day. It really peaked then, so they weren't willing to take her off. They were afraid that, she wouldn't start breathing on her own, and if they have to re-intubate, it could do a lot of damage. So they just left her on.
Right.
Well, yeah, the day they intubated her, they or extubated, was 7 days. Um, and of course, they started to wean her off the medications then, but because it had had a week, that's just long enough for
Yeah.
her to become dependent, she started withdrawing. And I
Oh.
think that was the day I started. That was the day I started ugly crying, like
Yeah.
every day.
Oh, I felt so bad for you.
I know. The day I watched her do that, because just she would cry and scream and puke and shiver, and she had a fever, and I'd hold her and she'd still scream. I'd try to pat her and she'd still scream. Just no matter what I did, you couldn't console her.
Yeah.
I'm tired. I want to go home. I'm missing school. We're missing the kids.
Yeah.
They during her NICU stay of that first month, they didn't even get to meet her until she was a month old. And
Oh.
then like, a month and a half later,
Yeah.
we're going away, it really kind of really messed with the kids.
Yeah, they're like, where's my sister?
Yeah, yeah.
And
Jason
my
got to the
mom.
point where he wouldn't even talk to me on the phone.
Yeah.
Like it kind of hurt him too much. He would send funny pictures and he would laugh about the funny pictures I sent back, but he wouldn't talk to me.
Michael did the
Um,
same thing when and I'm not even that far from him, but because I stayed at the hospital
right.
for the tongue reduction, after a while,
Yeah.
he would, it was too much.
And they would have been about the same age, right?
Yeah. Yeah.
Like Jason honestly started wetting the bed again. Like he'd been potty trained for quite
Oh.
some time and he was just so stressed out, so upset that he started wetting the bed again. It took a long time to kind of get him back out of that when I came home.
Poor thing.
Yeah, so as soon as she starts withdrawing, right, I'm ugly crying, and I remember Dr. Taylor would come in every single morning that he worked to come check on us.
Oh.
Um, and so I'm ugly crying the moment he walks in already. So I'm sure he's like in the back of his head, he's like, whoa. But I mean, he still came. He still sat down. He
Yeah.
still put his hand on my shoulder and he's like, look, he's like, you need to take a few minutes. He's like, you need to regroup. You're not going to be any good to her if you're no good for yourself. So he ended up telling me like the route he likes to take when he's kind of feeling down, just kind of needs a boost. And that actually helps. I remember
Yeah.
walking like 2 straight hours one way and then it was like, oh crap, dude.
I have to turn back around
I
now.
gotta go back. Yeah. Yeah, yeah. I remember before I came back though, I ended up trying out that Irish pub.
Mhm.
I can't remember what the name of it was. It was a nice place, but I sat there for, another couple hours just because my feet hurt at that point.
Yeah.
But I sat there and for a while, like I was looking for chop bracelets, right? The parent bracelets.
Yeah. Yeah.
And eventually, like the guy that had been sitting next to me the whole time, I saw his. I'm like, oh my God, you're a chop parent. Hey, what's up? Like,
Yeah.
let's bond. Um, but yeah, I started kind of hearing about his story and everything that his little girl had been through, some of the like pioneering technologies and procedures from his doctors at CHOP. And I don't know, it kind of put it into perspective for me. Like her battle was a little bit harder, you know, it was a little bit more serious. And that was like the same thing I kind of experienced in NICU. You walk through that NICU and you see babies that are in worse condition than yours.
Mhm.
You see some in better condition, some the same, but like it was almost bittersweet. Like, I don't know, it's almost like grateful that my daughter doesn't have it worse, but then it's like pain for all these other families and babies and mommies and daddies going through so much worse.
Right.
Um, and I think like talking to one of those parents at CHOP at the pub, I think it kind of really put things into perspective for me. I was caught my second win, so to speak,
Good.
Um, so I went back like stronger than ever, determined to get her through it. And I mean, we did. We were there for 12 days, 12 days out of school, 12 days without my husband or my other kids. Um, I was so glad to go home.
Oh yeah. I don't blame you.
The drive back was nothing.
Yeah. You were like ready.
Yeah, I was going a little fast. I'm usually like afraid to drive,
Yeah.
especially in places like that. That's the worst thing about Philly. It's so packed, and
I know.
I remember it took me the first day, it took me an hour to get from Chop to my Airbnb 10 miles away. I'm like, are
Oh,
you kidding me? I come from a place where I drive 60 miles in 60 minutes.
yeah. Yeah.
But yeah. Yeah, as soon as I got back, they're like, never leave, Mom, never leave.
Oh,
So, I didn't obviously. We ended up having to go back to Chop this last spring.
yeah.
And we turned it into a little family vacation. Yeah,
Yeah,
we
that
ended
was
up going to
cool.
Chuck E. Cheese with Teresa over here.
That
It
was
was a really
fun.
nice time. That was what we wanted to do. It was a lot. They still talk about it all the
Oh.
time. You know. Yeah, he was excited. Jason talked about Michael as soon as he heard that I was going live with Teresa.
Oh, did he really? That's so cute.
Yeah, yes.
We gotta have
Yep.
the boys
But I
FaceTime.
like that I know, we keep forgetting.
I know we're
It's
the
just gotten
worst.
so crazy with trying to like transition into this next chapter of our lives.
Yeah.
But yeah, so anyway, once we got home, um, still had to do all the screenings and everything. The hole in her heart ended up closing up, thankfully. So
Good.
no heart surgery there. She still does have the bilateral hydronephrosis and her refluxes. Um, they're putting in paperwork to start her physical therapy 2 times a month instead of one that she's been doing. Um, she's still not walking on her own. She's 13 months old and she's still not walking. That's within normal range, but
Yeah.
her hip muscles are weaker. Like she's a strong little girl. She didn't have low tone or anything. It was diastasis recti,
Mm.
but those abdominal muscles are pretty important. That's
Yeah.
kind of where you get a lot of your movement from. Trust me, I know. I was cut open when I was 4 months pregnant with Jathan.
Oh my
So
God.
that, oh my God, just laughing hurt. Moving my
Yeah.
arms hurt
Yeah.
from having my stomach kind of open. But just like her hip muscles and abdominal muscles are still a little bit weaker, so she's slightly behind. And then they want to bring speech therapy back in because they're a little bit concerned about her sound production. Like
Okay.
she understands everything perfectly well. She's super freaking smart. She's sassy. She's
Mhm.
starting to get her hands smacked these days.
Yep.
Um, but she's not really talking a lot. Like she'll communicate in other ways, but
Yeah.
she won't really say a lot. And then she kind of gets like stuck on words. Like she'll learn a new word or phrase, and like that's all she'll say for weeks, like nothing
Yeah.
else. So they want to start working with her on that. They're afraid that because of the tongue reduction and everything, that she might be a little bit more behind if we don't do anything about it.
Right.
Um, and then, but she's doing good. Her cancer screenings are all coming back good.
Good.
She's about to start going to daycare full time. Yes.
How do you feel about that?
I am freaking out. I mean,
Yeah.
not only am I about to go to school full time 1 more year, you know, I'm gonna be missing my kids, but now I have to like trust that they're perfectly okay at a daycare situation.
Yeah, that's hard.
So I don't know. It's just big changes for all of us. It's for the best. I
Yeah.
mean, I'm doing this to like provide a future, a better one.
Yeah.
But good
You're a
Lord,
rock
I'm
star.
freaking
You were
out.
doing all your school stuff when you were doing all of that. I don't know how you
Yeah.
did it. Oh my gosh.
I don't know either. I don't know. I kind of like threw myself in it. I don't know, the very first semester I enrolled, I got a 4.0. So it's almost kind of like, oh no, I have to keep getting that same grade. Like I can't do any better. So it was almost like a game with myself. I had to like prove myself to myself over and over just to like say that I can do this. This is where I'm
Yeah,
meant to be. I'm on the right track, and I've maintained that the whole time.
that's
And
awesome.
4 more semesters, and I'll have my degree,
Good for
and
you.
then I can be done for a minute. I can
Yeah.
rest and relax for a while.
Yeah. That's awesome.
Yeah, because it's not only that, but it's like the trying to raise awareness over here with all the DVDs and the info and
Yeah.
oh my goodness, there's a lot going on. Andrew sometimes makes fun of me.
Yeah.
Like I'll be on my phone, he's like, "What are you doing?" I was like, "I'm talking to a BWS person. Give me a second. I'm like right in the middle of this. Like I can't." He's like, "Oh, good Lord."
But if none of us do it, then it doesn't happen, you know?
Yeah, no, and he gets it. He just
Yeah,
likes to tease me because I'm like
much the same
always
way.
like I try to stay really active in group when I can.
Yeah, no, you're great in the group. You're always good with providing like the diagnosis features and stuff like that. I know I've texted you a few times for the actual printout. I'm like, Mckenzie, can you send them to me?
Yeah.
So,
I just really try to read all the articles. When I was in shop, they had found out I was in nursing school, and ever since Livy's diagnosis, I knew that I really, really liked genetics, in a couple other areas. But as soon as she was diagnosed, it was kind of like, ta-da! Like
yeah,
maybe you should look into this more.
yeah,
I'm still thinking about it, but I found out through another girl in group that it's a little bit longer than I thought it was. And I just
yeah,
kind of like to take baby steps, so maybe it's still gonna happen. But Dr. Kalish found out that I was in school, to kind of be in the healthcare system. And she ended up giving me a ton of paperwork, like absolutely everything they had that she could obviously give to me. And I've poured through those. I've looked up a bunch of other scholarly articles. I just try to stay really educated,
yeah.
because I take every opportunity I can to talk about it. I
Good.
mean, whether it's in a group or in the store when somebody says, "Oh, she's cute," and I'm all like, "Yeah, she has Beckwith-Wiedemann syndrome." Da 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 da.
Ah, that's good though, because people don't
I've
know
done
what it is.
speeches on it. Yeah.
Yeah,
Yeah, I mean, and almost always I met with like, oh my gosh, tell me more. Like, wow.
that's
People
good.
get invested in our story. Next thing you know, they're like adding me on Facebook or something. I mean, maybe once or twice did I get a rude comment, and it's
Really.
just kind of like, okay, we're just gonna walk away. Like, it's all right. You don't get it. I hope that you change somewhat someday with, how you approach things. But,
Yeah,
I told you about it, and I'm not gonna like we're not gonna argue. I'm not gonna be mean or something. I'm just gonna take that insensitive remark and kind of
right,
use it to make a positive and maybe say something a little bit different next time.
right.
But I mean, for the most part, people really enjoy hearing about it and learning about something they don't know. you know um I changed her pediatrician halfway through, and he's almost more into it than I am.
Yeah, that's good.
He came in and he's like, look, he's like, I'm not a BWS expert, never heard of it, but I've been starting to research it. Can I ask you a ton of questions? And
Wow,
he literally did. Like, he made sure everything that needed to be checked was already checked, made sure everything that should be already happening was already happening.
that's good.
And then just had a bunch of questions, for his own purposes about it. I gave him a DVD, I gave him paperwork. He made copies of like her molecular report and things like that, sleep studies to kind of look over. And um,
That's
I
really
remember her second appointment, he came in the room and he was just grinning. He's like, best thing ever. He's like, I think this was meant to be. He's like, I feel like I found another child that could have Beckwith Wiedemann.
oh
He's like,
wow,
I sent them for genetics. So
that's
yeah, they're
awesome.
still waiting on results, I believe. But obviously he can't tell me a lot.
Right, yeah. No, but that's so good because if that's the only way that most of the
Mhm.
doctors learn about Beckwith is
Yeah,
by first getting a child with it and having to Google it first and then learning about
yeah,
it from the
right.
parents. I mean, that's really how it usually
Yeah,
happens, unless you're
yeah. And I
running a
actually,
shop.
oh, go ahead.
Unless you're running
Yeah,
a shop.
right.
That's the only
Oh,
other reason.
hmm yeah. I remember, I don't know, it was pretty early on that I started having Anita send me like all those BWS DVDs she sends out for free
Hmm.
to new members in the mail. She supplies me with them, and I started just kind of passing them out to every provider she normally saw. And then I started printing out, like some of the features and the risks and stuff like that to kind of go along with it. But trying to like keep it as simple as possible so that like whoever gets it will still look,
Right.
still kind of get interested, or at least, if they skim through it, a couple words might, stick in their minds. Um, so after I gave it to everybody that she already knew, I started giving it to their colleagues. I started giving them to different people. And like, I don't know if everywhere has these places, but in Portland, where I live, there's a pregnancy care clinic that deals with like pregnant mothers, especially those who like need help or are
Mhm.
young or something like that, to try to help support, help give them resources and products
Right.
if they need them. but they see a lot of pregnant women and young children. So I started sending them to all the pregnancy. They gave me a list of all the pregnancy care centers, so I started mailing them to them. My old OB asked for a bunch to pass out to a bunch of like high risk centers and everything. So they're kind of really going around and they're starting to make their rounds. I've done, a couple speeches in different classes, and I
That's
remember making a
awesome.
poster board for extra credit. Yeah, it was supposed to only be up there for a week just to get my points for a class, and she liked it so much that she's kept it up. It's been there for almost a year on campus. I mean, like,
Good.
granted, it's a college, but plenty of those girls are moms and dads too, and
Yeah.
you know,
And it just makes you wonder, like, how many kids haven't been diagnosed that really do have it, and like they haven't been diagnosed just because people don't know
that's
about it.
yeah, and that's honestly, kind of why I started doing it is because just like that, from pregnancy, from halfway through my pregnancy, I knew something wasn't right,
Yeah, I
and
was
I don't
thinking
have a
that.
degree.
Yeah.
And just kind of being dismissed and not saying that they're bad doctors, but if they don't know about it, they don't know about it. And just like that, a lot of the markers can be easily like, oh yeah, that's a coincidence, or oh, it's probably part of this.
Mhm.
Um, and that's what everybody's always said about her, when they find out is she looks so normal. I
Yeah.
mean, even when her tongue was still big, which it really wasn't that big at all, everybody's like, she looks so normal. Like, so
Yeah.
that's kind of like one of my opening lines now too. Like you can't tell by looking at her, but
Yeah.
she has this syndrome and this is what it means, and this is what it could mean for other families out there. That's kind of who I'm trying to like raise awareness for, is the people that aren't getting that,
Right.
you
Exactly.
know,
The
that
people that
attention
it's
and
not as obvious
diagnosis.
for, like, some, because some of the babies it's not as obvious on them. Some babies it is,
Hmm.
where it's like, okay, like I feel like Owen was pretty obvious, but some
Right.
like your daughter, I don't think was as obvious as Owen's. I know Alicia's
Hmm.
daughter wasn't as obvious. Some of them look perfectly fine. Like there's not anything going on. So it could just be a couple different
Yeah.
things that people need to be aware of. And I know like a lot of times I've heard people say that when the babies are being born big, that they're just chalking it
Hmm.
up to gestational diabetes, and that's what they tried doing with me.
Yeah.
And I was like,
Yeah.
I never had gestational diabetes at all. Like I was never even
Hmm.
borderline. But they're like, no, that must be it because his belly's so big. His belly's so big. And I'm like, no, I've been telling you since 20
Right.
weeks that something isn't right with this baby. And I think
Hmm.
like if I wasn't like if he didn't have the tongue and the hemihypertrophy and the low sugar, I think we would have been
You would
set.
have taken, yeah, you would have
Yeah,
believed it.
yeah, I would have been like,
Yep.
okay, like that's what it is. But with the tongue and his right side being bigger, I was like, this doesn't make any sense. And so I like pushed
Hmm.
it. But I don't know if other people push as much because you think doctors know everything, you know?
And that's how, I was in the beginning. Andrew, not so much. Andrew's more assertive when he needs to be.
Hmm.
But I don't know. I don't like confrontation. So I don't
Yeah.
like telling somebody, oh, hey, you're wrong, or I don't believe you, or I'm not comfortable with this. I don't really like putting it out there like, hey, there's an issue here.
Right. Right.
Um, but, it was as soon as they told me about that distraction and started pushing that and telling us they would never release her, it's like, okay, like, enough's enough. I'm gonna get smart real quick. Like, give me a second to
Yeah.
give me a second to go read and get smart on this.
That
So,
sounds like such an intense surgery for a little baby.
yeah. And that's one of the things that Deanne said was like, look, if her jaw is already in a proper alignment, which it was, like it's going to cause her more problems. Not only, like I said, did they want to deform her and actually bring it out to where it's like very physically in front of her face, like that's
Oh.
what she said. It's not going to like change the shape of the tongue. It's going to mess with her teeth now. It's going to mess with her speech. It'll probably like, and I remember him telling me that one of the things about it is when he did the surgery, he was going to do permanent nerve damage,
Oh my
but he was
God.
choosing to damage nerves that he didn't find as important as some of the other nerves. Like, it's like, whoa, okay, like she's not gonna be able to like smile all the way or like move her
Oh my
mouth as
God. Thank God
Yeah,
they
it was
tried
just
that.
scary hearing his plan.
Yeah.
Yeah. Yeah, Deanne educated me pretty quickly, and then I found the group, started reading everybody's stuff, started asking questions. Everybody, like I remember I was going through those things for hours,
Yeah.
while I was in the NICU, just reading, and Angel's like, "What are you doing? What are you doing? Like, what are you reading?" And it's like, look, I got like 67 comments. I will talk to you tonight. I gotta figure out what we're doing next, you
Yeah.
know. And that's kind of why I'm so active in the group, especially it's usually if I see somebody ask something that I know somewhat about and like nobody else has messaged yet, or if I see like some conflicting information, I'll try to like chime in there.
Yeah.
But it's like the newbies I'm going for just to
Yeah.
help them how I was helped. And
That's good because you know
I get
how
like
it
private
feels.
messages on the side, and it makes me feel good about myself. Like I'm glad that I can help people because like everybody else in group knows, it's really scary
It is
at
scary.
first. Like that first 12 months, which she's only 13 months now, first 12-ish were
Yeah.
really scary. I mean, it took a while for her to recover from the surgery, of course, with all the swelling, the stitches. And
Hmm.
there was one time where she pushed out a blood clot. I'm like, oh my God, is it opening back up? Are we going back for more
Oh,
surgery? Like, I'm in Indiana now.
yeah.
Um, but, after her time recovered, the sleep study, they did another sleep study about 3, 4 months later after her surgery, and she's still technically severe. She's at a 13, which anything above 10 we know is considered severe apnea. But the actual apnea, the obstructive apnea, is completely gone. It's just hypopnea now.
Okay.
Um, and they've kind of been monitoring that. But her case is mild enough that everybody's really confident that will resolve with, speech skills and just kind of strengthening that area.
That's good.
So we'll do another sleep study towards the end of the year just to kind of check in with that. But I mean, she's really thriving. I mean,
That's
she's
awesome.
super smart. She's super on the go. She's a heathen
No heathen.
for sure. Yeah,
She's ruling the roost.
yeah, like she's taken a lot of the screenings and everything pretty well.
Yeah.
But the one thing she has gotten from it, I realized it kind of clicked in my head the last cancer screening. I took her in for her blood draw. I've got her like right arm laid down on the table, and I'm kind of like pinning the left side of her body. I've kind of got my arms around her chest and her shoulders to kind of pin that down in case she wants to
Yeah.
buck. So I see her like watch them draw the blood, like completely not phased at all. And they take the needle out. They got enough blood. She kind of looks over and realizes I'm pinning her down, and then she flips out.
Oh my
And then it
gosh.
kind of clicked. That's what she does. She does not like being pinned down by anyone in any situation.
Yeah.
Even when I'm like holding her, sometimes she'll like gently move an arm away. Like if she feels like that's one arm too many,
Yeah.
she'll kind of just move it away.
That's so funny. She's like, I need an
Yeah,
escape plan.
dude. Yeah, I've actually like had to write that as a note in her daycare paperwork. Like, don't pin her. Like,
Yeah.
less is more.
She'll get so mad. That's how Owen is.
Yeah,
He'll get so
yeah.
fired up. And I don't know if like that is because of when he had his tongue reduction, like he needed to be like restrained. They had like all these blankets and swaddles
Mhm.
and everything. So
Yeah,
I don't know if that has anything to do with it, but he hates it. He hates being held
yeah.
down, anything. It's the
Yeah,
worst.
I think kind of all of that, led to that.
Yeah.
Somewhere subconsciously they kind of like remember that feeling. Because just like that, even when she was sedated, she would still come to, and like
Yeah.
kind of realize, oh, I can't do crap. I
Yeah.
can't speak, I can't cry. I'm just laying here. For
Yeah.
so long, it was just kind of me and her and hospital rooms and laying and
Yeah.
I kind of understand that she doesn't like that she doesn't dig the doctory vibe.
Yeah.
She does do well, but she don't like it. She'll let you know that she don't like you. And it's just doctory people though. She loves
That's
everybody
so
else.
funny. That's so funny.
Yeah, I
So
know. They're all freaking characters.
they are characters. I mean, is she in the registry? Is she in the registry at CHOP?
Yeah, yeah.
Oh, good.
I
Okay.
gave them like access to everything for a lifetime. I'm like, look, if she someday decides she doesn't want to be a part of it, it's okay for her to like take herself out, right? And they're like, oh yeah, yeah, yeah. Like, okay,
Yeah.
like I let them keep the tongue that was cut off. I can't remember like how much they took off like in inches, but I remember it weighed 5.95 grams. The
Wow.
tongue actually had Hemi in it. They were able to get 27 samples for the registry.
That's awesome.
But yeah, I've given them access to like every medical record from here, like pictures. They're allowed to use it for research purposes. They're allowed to like share it with other families and stuff like that. But of course, they reminded me that it's all like um, classified. Like you might see a picture or hear a story or something, but they don't like share any identifying information. You
Right.
know, but she's in it for a lifetime if she
That's awesome.
wants.
So
Yeah.
how is her tongue now? Does it look, she doesn't have, what type does she have? What type of BWS does she
IC2.
have? Okay. And is that the least?
She's an IC2 baby. She's the lowest risk.
Right.
Yeah, like 2.8% roughly. I mean,
Okay.
it somewhat varies depending on like the paperwork you look at, but the
Right.
lowest, I mean, even below a negative test result, BWS baby. Um,
Good.
but she still follows like the protocol that Dr. Kalish likes every 3 months for everything,
Good.
and I'm really comfortable with that. I know how cancer works and I know how the treatments work. Um, my husband opened the door, so now the kids are freaking out. Um, Hang on. Give me a hug and go back in.
But
Go, 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 go.
why are they staying out here?
So, like, nobody's allowed in the camera. All right, go back in. I'll be in soon. Love you.
Oh, they're so cute.
Yeah, so I know, like, what the risk is with the cancer. Okay, I don't know if he's coming out. But, like, my cousin, he's a couple years younger than me, but when he was 3 years old, he was diagnosed with acute lymphoblastic leukemia. So we kind of watched that whole process,
Yeah.
all the sickness, all the bloating, all the baldness. It
Oh.
took years for him to go into remission, and even as an adult, he's still kind of sickly. Like he's healthy now. He's been in remission for quite some time, but he's very easily gets sick very easily. And then Olivia's physical therapist, her daughter has had a lot of issues with cancer and different things, not related to BWS, but one of the tumor types that BWS kids can get, the neuroblastomas, her
Yeah.
daughter actually got one
Wow.
when she was younger, towards the base of her spine, like lower back area. It was attached to the spinal cord, and she had to undergo chemo and radiation, and the treatment actually completely burned her ureters, like it fried them, it destroyed them. She couldn't physically pee. They had to actually go in and remove all that and basically put in artificial ureters to help her. So I
Yeah.
know how important it is to kind of stay on top of it to make sure if it happens, you get on top of it as quickly as possible.
Especially because in our kids, like cancer is already an aggressive form of something growing, and then
Hmm.
in our kids, it's like hyper speed with that.
Right. I mean, who knows? Like, there's still so much that we don't know. There's not a lot of data out there.
Right.
Just like that, you can kind of get data on what's actually happening, but they can't really test on, oh, hey, we let this kid go without treatment for this amount of time. They were
Right.
still fine, or it grow at a normal rate. You can't really do those kind of tests.
Right.
So you have to go with the data you do have. And I mean, that suggests that, routine monitoring and that kind of increases your chances. It increases like the likelihood that treatment's not going to make you as sick or have as big of an impact.
Yeah.
So I don't know. I'm more conservative. I pray that it never happens, but I am on it if
Good.
it's going to. But just like that, I mean, it's a parent's choice if they're not comfortable with doing it that often, because just like that, thinking about the trauma it might cause is a real concern. I mean,
Yeah.
I've seen posts where some kids are just truly traumatized by all of it,
Yeah.
but for me, we've gotten lucky so far, and I'm just going to kind of continue on this way.
Yeah. That's what I'm gonna do. Because
Yeah.
Owen's the UPD, so he's the higher type. So I'm like, I'm not messing around
Hmm.
with what he's got going on.
Yeah. I
especially because
definitely wouldn't. I
he
mean,
just gets so big so quick that I'm constantly like, I wish I could see inside your belly. See if
I
there's
know,
something in
right?
there.
Yeah, Olivia's like a 1-year-old trapped in a 2.5-year-old's body.
It's ridiculous. Have you gotten
She's
like
big.
have you experienced issues with strangers like thinking that she's older or anything like that yet?
I mean, people do like mention how big she is.
Yeah.
That's really the only one I've gotten since her reduction. Like some people would ask what was up with her tongue. I mean, they wouldn't be like, "Hey, what's up with her tongue?" Most
Yeah.
of them would ask in a more sensitive way. But yeah, a lot of people do comment on her size and her weight. Nobody wants to hold Olivia. When we get together, I pass her off. I'll be honest. Like I've
Yeah.
done held this 24-pound baby a lot today.
Yeah.
But
Sure.
it's just really size. I mean, other than that, she looks normal.
Yeah.
And she's what, 32 inches and 24 pounds. She's been 24 pounds since she was like 6 months though. She hasn't gained any weight.
Yeah, that's how
Her
Owen was
appetite
for a
is
while.
huge.
Yeah.
Yeah, I mean, we kind of figured that obviously, even though she wants more than a typical baby, she's obviously using it.
Yeah.
She's not obese in any way.
Mm-mm.
Just like many of the BWS kids aren't. They all use what they're taking in.
That's the other thing that's kind of scary too, because I've seen a lot of parents on the page say, my
Mhm.
pediatrician is telling me not to give to
Yeah.
to put my baby on a diet. I'm like, don't put your baby on a diet. Like they have such a ramped up metabolism because of their syndrome. They are actually starving. Like they're very, very
Right.
hungry. Like I know when I feed
Right.
Owen, I mean he doesn't stop. At the conference, I swear he had, if Chris is still on here, he can vouch. He had 7 pieces of cake,
Hmm.
like one after another. Like
Oh
went to the
my
table,
gosh.
grabbed a piece of cake, put it down after he was done with the plate, went back. We counted. He ate 7. I was like, am I supposed
I
to put
would.
an end to this or what? Like, what am I supposed to do? It's
Oh my
ridiculous.
God, I would have felt so horrible. I would have been tempted to eat 7 pieces of cake. I'll
I
be
was like,
honest.
oh my gosh. And it was funny because he would go to the table and like look around and like see if anybody was paying attention to him. And yeah, Bree just
Hmm.
commented, ha ha ha, he ate so much cake. He just like, it just wouldn't stop. And every time he was so excited about it. I'm like, I'm not,
Oh
whatever.
my gosh.
Don't let him eat his cake. I'm like,
Yeah. Yeah. She'll fight over her food. Like
yeah,
she'll yell at you. She's usually like always happy, always smiling. But if you mess around when it's food time or milk time, or if you're eating, like she'll yell at you. I would
yeah,
usually because she's constantly moving. She constantly wants to be moving, so she doesn't really like sitting in a seat too much.
yeah,
So I just kind of feed her off of my plate a lot. And anytime that I stop giving her a bite to take my own bite, she yells, she
yeah,
hollers. It's
yeah,
like, oh my God, child, okay, I'll sit here for the next 20 minutes and feed you and then get my plate afterwards, I guess.
yeah.
Yeah.
So funny. Cannot mess with their food. That's why I'm like, oh, I
Mm-mm.
just wish, like, I hope that through doing this, through like you doing the DVDs and like the pamphlets and
Mm-hmm.
all that kind of stuff, like I just hope that like just regular pediatricians just get an understanding of these kids and how to handle them because,
Yeah.
you know, parents go to them for guidance and advice, and when they don't understand what the syndrome is or what it does to the kids, and then they tell them like you're feeding them too much, or you're really not feeding
Yeah.
them too much. I mean, I
Yeah.
can hear Owen's belly and it's empty. I can hear the food going into it. I'm like, I know it seems crazy because
Yeah.
I just fed him like a 5-course meal, but he's hungry.
Yeah. Like I'm not saying like I understand that not a lot of doctors know about this and just like not a lot of parents know until they're thrown in that situation. I
Yeah.
don't think that makes them a bad doctor, but I have
No.
heard a lot of stories where they've said a lot of horrible things. Um, I remember seeing a post a long time ago about a doctor telling a mom that because her baby had BWS, like she might not go to Harvard, but she live a perfectly healthy life. Like I've those things you don't say. I mean, I feel like if you find a patient with a syndrome, I mean, either pass them on to somebody who's comfortable with it, comfortable learning. I mean, that's your job. Like you should
Yeah.
learn more about it, find the right information, tell
Right.
people the right things. Because a lot of parents go home feeling dismissed or like scared or, thinking that something that's never going to happen will,
Right.
just like that. Like, that would hurt. You're saying my baby can't achieve this if they want to, that, they're going to be healthy, but all the other things we want for our kids just isn't going to happen or what,
Yeah, and it's like,
you
where are you
know?
basing that from?
So,
Like, where are you getting that from? Like, that's what I like. Some of the things that,
and I kind of wonder where they do.
yeah, like, where does that come from? Like,
Go ahead.
some people, I've heard when their babies are diagnosed, when they're
Hmm.
pregnant, some people are told by their doctors, like, we advise you to terminate because they're not going to live a normal, healthy life. And it's like, what are you talking about? Like,
Oh, wow.
yeah. And like, people don't know because they haven't heard. Like, I'd never heard about
Hmm.
BWS until Owen had it and until he was diagnosed. But like, if I was told that and not knowing what the syndrome was, it would terrify me. I mean, it wouldn't change my decision to have him, but it would still terrify me. And it's just not true at
Definitely.
all. Like, some of them are more severe
Yeah.
than others, but they, for the most part, like, are strong and live extremely well balanced lives.
Hmm. And that's the scary thing, is getting advice from somebody who doesn't know about something, whether it's BWS or not.
Yeah.
That's what the first when I wanted to switch my daughter from like her first caregiver, which was kind of done on the fly. We didn't really know who to go to, so we just kind of like wrote a guy's name down. Ended up being really unhappy with like that clinic and their staff.
Hmm.
But when we switched her, we originally wanted to put her on with our family doctor, who everybody else sees. Um, but he ended up declining her, said he wasn't comfortable. And at first, like, I was devastated. I was like personally offended.
Yeah.
I cried a lot. But then, after I gave myself a chance to kind of like dry my tears, I was like, you know what? I was like, maybe that's a blessing in disguise. I'd rather him
Yeah.
be honest and tell me, hey, I'm not comfortable. I don't know anything about it. I might not have the time to learn about it. I think you could find somebody better, which
Yeah.
I did. I'm really happy with who I found as our pediatrician. He was completely willing to take her and willing to learn and put in that work. So, I mean, it's been a blessing to have a team like that. I mean, we've had some doctors that we weren't so happy with, but like the few we trust with her main, care and issues right now, like, very happy to have a team willing to learn, willing to take the information, willing to share it with their colleagues and be on the lookout for it. So, I mean, that's just, I don't know, I've been pretty big into the awareness thing since this all happened. Just
Yeah.
to, an off chance. I mean, like Dr. Kalish said, the prevalence is probably a lot more because
Hmm.
so many people go undiagnosed.
Right. And I think that's what makes
Hmm.
people not really, I think people don't really realize it with this kind of stuff. Like, even some people, I've talked to people and they're like, well, I don't really get it because like Owen's fine. And I'm like, well,
Hmm.
define that, because are we not supposed to talk about it until he's not fine? Like, what if he was never
Yeah.
diagnosed because he looks fine and then he winds up getting cancer in a few years? Like, that has probably happened to children because they look fine. Like, it needs to be talked
Yeah.
about before any of that happens so that they get the screenings that they need. So I'm hoping that, like, with everything I'm doing, you're doing, um, I'm hoping that it's making a difference, that people are starting to become aware. And now I find myself like looking at little kids and I'm like, like,
I do
wondering,
too.
do you?
I do too. There was I started kind of recently going to church again lately. And there's like a little daycare center for them, and I saw a guy I was familiar with holding a baby. And I'm like, oh my God, like trying to nonchalantly like get closer so I can stare at this baby in a non-creepy way to find out, okay, is that a stork bite right there? She's a little chunker. She's a cute little chunk. Like, let me
Yeah.
check out her ears over here. I'm always on the lookout because, as scared as I am with confrontation and stuff, like I would say something. I
Yeah.
just have to. I mean, I wouldn't like it. I wouldn't like being like, okay, waiting for his, their response to be like mean, maybe. That part
Yeah.
would terrify me.
Right.
Or to scare them. I don't want to scare them, but I mean, just because of the risk, I would have to say something.
I would too. I know. And Mike always tells me all the time. He's like, I'd be like, Mike, look at that kid over there. And he's like, oh, here we go. Here she goes. I'm like, but just look at them.
My
I'm
husband's got
serious.
kids too. Yeah. Yeah.
I'm like, if that were my child and I didn't know, I would want to know, especially
Yeah.
because of the type that Owen has. Like, I mean, regardless of the type he has,
Mm-hmm.
but the fact that I know he's at the most increased risk. Like, if I didn't know, I would really want to know and have someone come and tell me.
Mm-hmm.
So I'm hoping that with all of this, it truly makes a difference and people are saved, really.
Yeah. I mean, I feel like everybody in group that's making motions to do, even if you're not like real big into it and you just have a couple papers that you're sharing with I mean, any little bit, just talking about it with your friends, your neighbors, people you meet in the store, like any little bit that everybody's doing in group goes a long way. And eventually, we won't have to be like, what's BWS? Nobody will have questions. Not so many anyway, I guess.
Yeah,
But
like I have a
you know
feeling
where I'm going.
over time it's going to be one of those things where it's going to be like, oh yeah, I know what that is, or I hope so at least, because I feel like I could have gotten diagnosed before, or Owen could have gotten diagnosed before I even had him, based on just my ultrasounds. Like I looked at them and I
Yeah.
was like, his tongue is the whole face. Like it's not just him sticking it out. Like his tongue's the whole face. His belly is huge.
Yeah.
He was huge. So part of me is like, I think if it was like, I love my hospital that I delivered at, it's where I work, but I don't think they've ever seen a Beckwith baby before. So,
Mm-hmm.
I don't think they initially thought of it until like a day later, until I kind of kept pushing the tongue and he was hypoglycemic and that whole thing. But
Yeah, and just like that, you're right. Like not during pregnancy, but immediately after, there were enough signs that if somebody knowledgeable had seen that, they would have been able to diagnose her off the bat, pretty much.
yeah,
And here in Indiana, blood sugar checks at birth aren't even like a thing. I
right,
hear in other states that they do them, but my kids, the only reason they tested Olivia in the first place was because she wouldn't nurse. They were trying
right,
to find out what was going on, but
right.
they don't do that, and that's like one little clue to being like, oh hey, we may have a problem, we may not, like,
Yeah.
you know.
How big was she when she was born?
She was 37 weeks exactly and just over 9 pounds and like
Oh,
22 inches long.
she was big.
Yeah, she's the biggest baby I've had. And that's what I'm saying. We knew, like, each of my kids has like a animal or bug nickname. And when we were talking about Livy's nickname, it was as a family. And the entire time I was saying she's all legs. Like, she's too big. She's
Yeah.
tall. Like, she doesn't have enough room. Turns out I was right.
Yep.
But we ended up calling her Grasshopper.
Oh,
So
that's cute.
through pregnancy, we knew. Yeah, and then after everything started happening, it was weird because there were actually like signs, kind of like that it was always like she's gonna be okay. Lena was born on a 4, Jathan was born on a 14, and Olivia was born on a 24. And then when she was in the NICU, they actually had webcams, so when we weren't there, we can kind of log on and see her like laying there.
That's cool.
Her username was randomly generated, and it was White Grasshopper after we'd
No.
named her Grasshopper.
That's
Yeah, we were like,
crazy.
yes, she's gonna be okay.
Oh,
Do
that's
what?
cool. That's awesome.
Yeah,
Do you have
yeah, we
any
definitely were lucky.
like concerns for the next couple years coming, like just her being in daycare, like, or not really, because with her tongue reduced, she doesn't look like it's not as noticeable. Like I don't notice it on your pictures of her anymore. It doesn't seem to have
Hmm.
grown or anything like that.
No, they said that it hasn't grown, and that the Dr. Taylor and Dr. Kalish aren't concerned anymore with it.
Good.
They're just waiting for the laryngomalacia to kind of resolve. But I mean, she's not walking yet, so of course I'm a little concerned about that. She's
Yeah.
not talking, even though she knows as many like words and phrases as she's supposed to. She doesn't really talk like everybody else.
Right.
Um, and I mean, I've talked to her daycare provider about it. She seems comfortable because there are no real big issues anymore.
Right.
It's just kind of like, oh, hey, I've got a kid with BWS. Let's watch her like a normal. And that's what I stress to people is like, she's still pretty much normal.
Right.
I mean, she's just a tiny bit different, but you treat her the same as any other kid.
Hmm.
And we've been honest and upfront about it with our kids, and we will with Olivia too, about what she has, what it means, and everything. Because we want to raise them to be strong, and just
Yeah.
like that, there are labels to them. She's not defined by her Beckwith Wiedemann, but they all have labels. I mean,
Yeah.
Olivia happens to have BWS. Elena happens to be a little fashionista. Jason a nerd, which nerds are cool in my book, so that's not
Yeah,
like
nerds are
it.
cool.
But I mean, people who are gonna bully or be mean are gonna do so regardless of what they're like bullying over. I
Right.
mean, if
That's
she
true.
didn't have BWS, if she's gonna get bullied, she's gonna get bullied for something. Um, which is
That's
why I just
a
kind
good point.
of just like that to us, BWS is just another like, oh, I'm into science. Oh, I'm this way. It's not that big of a thing, but we learn what it is and what it means to us, and kind of just teach them to be strong, to love themselves, to be comfortable with themselves, not to listen to negativity. And just like that, when we see that in other people, we
Yeah,
treat them the same as we treat each other here in the home.
that's good.
So I'm not too worried about it. And plus, if somebody bullied her, like I said, she's a fighter.
She would take care of it.
Yeah,
That's
yeah,
the
she, yep,
that's the feisty BWS part that they all have. Oh
yeah,
my
she'll
God.
whack Jason and Lena. When they try to manhandle her,
Oh yeah.
she'll whack them. She'll shove them off her.
Oh, and just the
Yep,
other
they
day,
know.
like really badly slapped his speech therapist. Like she wasn't ready for it, and I barely even saw it, and she was trying to do something with him that was aggravating him, and like she like turned her cheek for a second and like looked away from him, and he slapped her hard. Like she had like a mark on her face. I was
Mhm.
like, oh my God, I'm so sorry.
Yep,
So the
yeah. Like
slapping,
all my kids
oh
went through the phase of like slapping.
yeah,
But Livy, like cause just like yeah, she started slapping recently. Like she's always kind of slapped to like the air or something to kind of be like, hey, I don't like this, I'm not digging it. But
yeah,
recently she started like whacking people. And so I've honestly, started to smack her hands back a little bit, but she's
yeah.
still super sassy about it. She might cry and stop, but she'll have like the last word about
Oh
it
yeah.
for sure.
Yeah,
Yeah.
Owen will like grab it. Like if he was doing earlier today, he was trying to get a remote out of my hand because I was playing with Michael Jr. and I was like, no, Owen, you can't have that. So
Hmm.
he would go like this to the remote and like try and grab it real quick, and then I was like, no, Owen. So then he would do it to my pants, and like I'm just like, man, you are determined. You need
Yeah.
to pick something else. There's a million things in this room, but he was having his way. He wanted the remote.
Hmm. Yep.
Ridiculous.
They're all kind of like that actually.
Yeah. And I guess one last question is, what advice would you
Hmm.
give brand new moms that get this diagnosis? Because now you're kind of out of the first year, just about, and I feel like the first year was
Hmm.
the hardest. And that's what
Yeah,
a
I
lot
think
of
so
people
too, for
say.
sure.
So what do you think would, from your perspective, is the best thing that new moms that find out that their kids have this can do?
I mean, first and foremost, education. Um,
Mm-hmm.
Educate yourself, educate your doctors, trust your gut. You know your children better than anybody else does. So if you don't agree with something they say or question it or want to know more, I mean, voice your opinions and your concerns. But the other big thing, what is just to enjoy what you do have. Take your wins where you can get them. Was it Breeze that did the PowerPoint at like the CHOP conference that talked about mental health and stuff like that?
Yes.
Um, yeah, and I thought that was really important too, because before like Livy or any of my kids ever came along years ago, I was diagnosed with borderline personality disorder, and I mean it took years of getting myself in a good headspace and like kind of turning my life around and kind of recovering from that, so to speak. But when everything started happening with Olivia, I was kind of like thrown back in it.
Yeah.
I got real depressed for a while, just the diagnosis, seeing the kids in the NICU, the surgeries, the withdrawal, all that, just really freaked me out. And I was so dark and like just in a dark spot again. And I don't know, it kind of clicked because Olivia was always so happy, no matter what was going on with her. If she was in pain, if this was happening, she always had a smile on her face.
Right.
She was always really happy. And it just kind of reminded me that I need to be the same way.
Yeah.
Like, I've gone through so much in my life so that I could be a strong mother and wife and just person in general to do everything we need to do as a mom, as a person. And ever since then, like, I've gotten my second wind in life again.
Yeah.
I'm not worried. I'm
Good.
worried about some things, but I let like the little things go.
Yeah.
I just like, with the surgery, it was terrifying. But in the back of my head, I was like, well, this is going to help her.
Yeah.
We're going through this together. I'm there for her. She's going to get through this. She's going to be okay. I just really stay positive, and I don't let the scary stuff get to me too much because that takes away from what we have here.
Yeah.
And I don't want to put any of that fear into my kids,
Right.
especially the older ones who understand, but I don't want them to kind of model any of those, worries or behaviors.
Right.
So,
That's
education,
perfect.
trust your gut, be positive.
That's awesome. That's perfect advice. I wish I knew you
And-
when Owen was born.
and-
Because I was like,
oh my
oh, I
God.
was having a hard time the first year. I was like, I don't think I can do this.
Right? You guys are like exactly us, though. You just live so far away.
I know. We got to try and meet in the middle.
I know, right? We're gonna try to come. Well, we have to come back in the spring.
Oh, there we
Um,
go.
but
Yay.
we're probably gonna try to like make another little vacation. Just
Okay,
visit a
cool.
different spot or something.
Yeah, we'll have to find some cool things
Yeah.
to do when you come in.
Yep.
And then
Awesome.
and then we'll have to FaceTime on the regular with the boys. Because we keep
Yep. He would
forgetting.
like to see Michael.
Yeah. All right, that
Yeah.
sounds good. Well,
Life.
thank you. Thank you for coming on and sharing your story. I knew most of it, but I love to hear it again. And I appreciate
Hmm.
you as a friend and that I'm able to have you to bounce things off of. And I'm thankful that
Yeah.
I met you when I met you and we were able to just hang out and enjoy some beers and bond over just what our kids have. And
Yeah.
I'm very thankful for you and Olivia and your family. So.
Yeah. So am I. I mean, you kind of provided family at the time where I didn't have all my family. So yeah, you're definitely. I've got pictures of you and stuff in her box. Like, I keep BWS
Oh,
related things, just kind of tell her story when she's big enough. You're included in the story. I will never forget you guys.
oh, you're
You guys,
awesome.
and what you're doing here is awesome. Not usually an on the camera kind of girl. I was texting you that I was freaking out. I'm still kind of freaking out, but what you're
You
doing
were
is freaking
awesome.
awesome, and I totally support it.
You were awesome. You were like a public speaking pro.
Oh, oh my gosh, no.
Yes. You'll rewatch it once I have it all edited and you'll be like, "Man, I was really good." You won't even have to worry about it.
Hmm. Okay.
Well, thanks again
Cool.
and we'll set up a FaceTime for the boys
All right, definitely.
and tell them all
Thank
I
you.
said
See
hello.
you, Teresa.
You're welcome.
I will, for
All
sure.
right.
All
Bye.
right.